Yes, yes, absolutely. And that's an increasingly important area where live blood analysis, especially using dark field microscopy, is starting to show real promise. Not as a diagnostic tool in the traditional sense, but as a supportive observational tool. Now, with the emergence of mRNA-based therapies during the COVID era, and the growing number of people reporting persistent symptoms after infection or vaccination, many integrative practitioners, myself included, turned to live blood analysis to help explore what is going on at a deeper, more cellular level with their patients. Now, although we work with very high levels of magnification in dark field, it is important to mention that we can't see spike protein itself, because that would require us to look at the molecular level. What we can see, however, and what has become increasingly clear over time, is that we can see the effects of spike protein with dark field microscopy. And what's more is that we're actually seeing these patterns happening in real time in the blood. Now, this has made live blood analysis an especially useful tool to test various treatment strategies for patients affected by this condition. And this has allowed for effective treatment protocols to actually be developed as well. So, for example, we use this approach to monitor patients on enzymes like nattokinase, lumbrokinase, and serrapeptase. And this helped to show and prove in practice that we're able to break down microclots in these cases. Antioxidants as well, like glutathione and N-acetylcysteine, were used, and we saw an actual reduction in oxidative stress in these conditions. Now, there are various protocols and interventions that are used, and we have specific treatment protocols included in the training materials in the course. And what we consistently see in these cases by looking at their blood is a gradual return to healthier blood morphology. So we're seeing less clumping, healthier cells in general, and also fewer foreign synthetic elements in the blood. And all of these changes then correspond to improvements in how the patient is also feeling. Now, it's also a great motivator for the patient when they actually see this, when they can see their blood improving on the screen. It really is incredibly empowering. It's also very encouraging for patients to see this, because in many cases these patients have not opted for this. These are often shedding type of events where patients did not opt for this, and yet they are affected by this, which is of course quite extremely discouraging for people when they're able to see these patterns then actually shift in their blood as a result of treatment. It really is encouraging for them to see that there is actually hope for these things to change. So yes, live blood analysis does help to address COVID and long haul COVID health issues, and has actually been instrumental in vaccine injury research, where it's been used to help understand this condition better, and also to help develop effective treatment interventions.